Before we begin, I make an assumption that you've already seen your family doctor or perhaps a specialist, and despite their best efforts and the prescription of various pain medications, you're still in pain. Your doctor may have also sent you for a full blood work, an x-ray, or maybe an MRI, and nothing serious has been found, which may be more frustrating since you're still experiencing pain. You may have also had various treatments from other caring healthcare professionals, such as physical therapists, massage therapists, or chiropractors, and their treatments may have given you temporary relief, but you're still in pain. So why watch this video? Did you know that there's now pretty good scientific evidence that simply learning about how pain works can reduce stress, anxiety, and pain levels in those coping with what is known as chronic pain? There are thousands of books and medical research studies on the topic of pain, and only in the past 10 years it has been shown that when people who are experiencing persistent pain receive therapeutic neuroscience pain education, have much improvements in their pain, mood, hopefulness, and their ability to move. Some excellent reference books will be provided at the end of this talk. So here is the pain truth and nothing but. Let's begin with the important fact that pain is actually good, at least most of the time. For instance, if you put your hand on top of a hot stove, danger messages are sent up the spinal cord to the brain. The brain then interprets the message as pain and sends a message back down to get you to quickly remove your hand from the stovetop. If we didn't feel pain, the body wouldn't be protected from all the dangers out there. Therefore, pain is really needed for our survival. Pain is also good because when a part of the body is injured, say an ankle or back, pain warns us to protect the area for a few days or weeks to allow the tissues to heal. Think of pain as a warning signal, similar to a home alarm system. It tells the brain to take action and do something. Do this simple experiment. Take your index finger and bend it backwards until you feel some discomfort. Notice that the pain warned you to stop before you caused an injury. Once again, pain is good. There's one small challenge though. The brain can also produce pain even if there's no risk of tissue damage, or when the tissues that were originally injured have fully or nearly fully healed. Did you know that 70% of all those who lose a part of their body, such as after a leg amputation, still feel sensations such as itching, burning, or even severe pain in their no longer existing leg? This is referred to as phantom limb pain. And this phantom limb pain is felt in those who lose a finger, an arm, or breast. So why does this happen? Why would the brain make us feel pain in a part of the body that doesn't even exist? In 1951, Dr. Penfield, a pioneering neurosurgeon and a professor at McGill University in Montreal, discovered the fact that every single part of our body is mapped out in the brain. In other words, your brain has the image of your back, neck, leg, and toes all perfectly mapped out. This map in the brain is called the homunculus. What scientists have now discovered is that the image in the brain is all that is needed to produce pain, even if the body part is no longer there, or if the body part is no longer even injured. What you need to know is that this body map in our brain, or the homunculus, is constantly changing and can change based on how we use or not use our body. For instance, violinists have a larger representation of their left hand in their brain, while those who are visually impaired and read Braille have a much greater representation of their fingertips in their brain. Scientists around the world are discovering that pain doesn't always mean that something is injured or damaged in the body. As we've already discussed, people can feel leg pain, even without a leg, and trying to eliminate pain in a part of the body that is no longer there is obviously frustrating for patients and doctors. People can also feel back or neck pain even when doctors can't find anything seriously wrong. Trying to eliminate persistent pain by treating the actual area of pain is also often frustrating for patients and doctors. Let's do a short review of some facts about pain we've learned so far. Fact number 1. The brain can produce pain even if there's no actual injury to the body. Fact number 2. Pain doesn't necessarily mean that something in the body is injured. Fact number 3. Pain can persist even if the tissues that were originally injured have healed. By this time in my talk, you may be asking yourself, is this guy telling me that my pain is in my head? The answer is yes. All pain is in the head, or in other words, in the brain. The simple proof is that it's possible to feel leg pain without a leg, but no one can feel leg pain without a brain. In all seriousness, I must emphasize that all pain is real. The pain that people feel after an amputation, is it real? Of course it's real. So here are two more facts. Fact number 4, all pain is real. There's no such thing as imagined pain. Fact number 5, all pain is in the brain. Remember our guy who put his hand on the hot stovetop? That was obvious danger. However, fascinating studies show that even if a person believes the stove is hot and is told that it's hot and it's red in color, they will still feel burning, even if the stovetop is ice cold. Why? Because the brain is very powerful. If the brain believes something to be true, it will do everything to prove itself right. In other words, if the brain believes something is dangerous, such as bending forward, walking for a long time, lifting arms overhead, it will produce pain to simply protect you and your body part. Fact number 6, pain is an alarm system that warns the body of actual or perceived danger. Most people are aware that thoughts and fears can increase blood pressure, increase heart rate, and cause muscle tension or even spasms. If someone is told that their house is on fire or that they have to stand up in front of a crowd and publicly speak, it's very likely that just the thought of it will cause muscle tension and heart palpitations. Here's a question. Is the increased heart rate real? Of course it's real. Is the increased muscle tension real? Of course it's real. Many people are, however, not aware that just thoughts and fears can actually cause swelling and inflammation. Scientists have done experiments where they asked people with chronic hand pain to close their eyes and to only visualize opening a jar. After the visualization, the patients had increased pain and actual increases in swelling of their hands. Once again, is the increased swelling real? Of course it's real. Finally, you need to know that just thoughts and fears can actually cause or increase pain. When pain is caused by our thoughts, is it real? Of course it is real as the increased muscle tension and increased heart rate. Now that you're clear that all pain is real and that pain is not always related to an actual injury, you may be asking yourself, what is causing my pain then? This will be explained in part 2 of this 3-part series pain education video. I look forward to speaking with you and help you further understand pain and most importantly, what you can do about it.